Hi, good morning. It might not be morning back in Hawaii, but I hope everybody's having a good new year. I wanted to continue on with the subject about the Epipharynx gargle, which is very important. To take care of your health, we always recommend doing many types of, utilizing many types of lifestyle medicine, like earthing and, eating, proper and fermented foods and all this type of um, lifestyle activity that would take care of yourself. But within that, there's another important thing is the gargling. The proper gargling, um, using the salt water and cleaning out the epipharynx, which is up in the nose, right behind the nose, right where the mouth and the nose meet. It's in the wall area. So I kind of wanted to do a brush up on that today. First of all, the salt water. Maybe I should explain first one more time. Since not everybody might understand this yet. So first of all, a epipharynx area is right here. This is a diagram of your nose and mouth and your throat area. So if you see I don't know if you can see it. So it's right here. Okay, so if it's the blue section here, that's what I'm talking about. This area. This is your nose, nasal cavity, mouth right here, your throat, and this blue zone here is what we're talking about. And there's a little flap right here called uvula. There's a little thing that sticks out. If you open the mouth, and then you can see the triangular, like a pointy object that's sticking out. That is the uvula, and that wall, that uvula sort of closes. When you start doing a gargle, it closes so that all the gargling doesn't reach to the. It's hard for that. Salt water to reach that area that you're trying to target. So today I just wanted to talk to you about how to open that passage so you can literally clean the area without doing invasive, like flushing through the nose and doing other invasive method. This is real safe, and every day you could do it, and so I highly recommend doing this. Of course, it doesn't take care of the problem in one day, because it's such a gentle way of doing it. But I believe it's gentle is a better way to do it. So I'd like to talk about that today. And first of all, this epipharynx here, that's sort of like a switch for your immune system to start working. So like lots of times people are having a little bit of inflammation there, and that you can't really tell because it's not like always sore or anything. But if you have a stiff neck, stiff neck, if you have like a sinus problems, if you have like a postnasal drip, and of course if you have an immunity issue, and a lot of time you want to make sure that area is not inflamed, because that epipharynx is like a switch for your defense system of the body. It's like a commanding switch there. So if there's an inflammation there, you're gonna have all this killer T cells and all kind of white cells, all kind of a fighter activity in the body is gonna start kicking in, and it's really not a good idea to keep it going when you don't need it. So if you keep that, if you try to take care of your body and try to be healthy, and if you don't take care of that part, and you still got the immunity kicking in, and your sympathetic nervous system is always switched on, it's like you're trying to take care of the problem without taking care of the root. So very important in order to take care of your kidneys and liver health, heart health, the total inflammation. You want to make sure that area is clean. So just assume that area has a little bit of inflammation and you want to clean it. So we're gonna do this gargling, and we call it Epipharynx gargling. So what you do is you get a cup and you put a little bit of you want to make a warm water, and you don't want to use water that has too much chlorine. So I would use a clean clear water, and room temperature or a little bit lukewarm is better, to the body temperature, same temperature, and you put the salt in it. But the salt would be about maybe half a teaspoon into a small cup. It doesn't need to be a mug. It just needs to be a small cup. Put a half teaspoon, put a warm water, mix it with a spoon, take it to your sink where you brush your teeth, and you get that water, you put it in the mouth, and make sure the amount you put in the mouth is really light, not too much, very little in volume, because if it's too much, it doesn't go up the throat. It's very hard to do. So a little bit in the mouth, and then start gargling with a high-pitched sound. So you make your voice come out while you gargle. You make the voice, but you make it higher, the sound, the pitch, higher the water can get pushed up. So you want to try to push the water up, all the way up, much as possible. So you gargle and make sure you twist the neck, not twist the neck, sorry, you tilt your neck to about 60 degrees. So you don't need to go all the way, but just slightly tilt your neck, and then you gargle. And how to open your epipharynx area, the passage, is to use the maybe in English you probably use the term maybe H-O, like ho. So and you put ho. When you say that, in that split of second, the passage that is closed will open up a little bit, so that the salt water, gargle water, will touch that epipharynx just slightly. As soon as that touches, that's all you need to do. Don't keep doing it, because you're gonna have all the water gushing out from the front of the nose, and it's gonna be all messy. So just a little bit is fine. As soon as you feel that little burn there, just finish doing it. And once you look to the front again, if it's successful, you will see a few drop of water come out, backwash to the nose. You'll see a water come out from the front. Then what you do is you grab your hand and you blow your nose, so all kind of the substance, the junk substance and all that mucus will just flow out. You'll feel really clean, and that's the way to do it successfully. And I believe this way is the most gentle way, so it's not invasive, so it won't work. It won't suddenly you won't feel the difference like the next day or so. You're gonna have to keep doing it 3-4 days, since it's very gentle. But that's the best way to do it. To keep it gentle and do it every day, and that's the most important part of one of the important part of the lifestyle medicine. So today I kind of wanted to talk about that. Opening the passage to do your epipharynx gargling. And also for the addition, when you have a little bit of water left in your glass, you don't want to dump it, since if you're using a good salt and water, you don't want to waste it. So you use the rest to put it in the mouth, and you swish it now throughout the whole gum, in between the teeth. Imagine the water is going into the gum area, around onto the tongue coating. Just make sure you're swishing it. Salt water will not kill the good bacteria. The beneficial bacteria will remain there, but the bad bacteria slowly will clean out. So it's a really great way to prevent your gum disease, or the tooth decay and all that. It's really good for your oral health, and also to swish it. You're using all kind of a muscle to do it. So it's a very, very good mouth exercise. So I would definitely recommend doing that if you have a little bit leftover water. So try doing that every day. And that's it for today. Have a good day.